Our first speaker this afternoon is Nicholas Durr, Assistant Professor of Biomedical Engineering. Nicholas will be talking about eye care accessibility. His research includes a focus on using physiological information to improve diagnostics, guide treatments, monitor therapies, and enable the development of new devices for eye care.
All right, thank you for the introduction, Dr. Berger. All right, so you should be able to see my my slideshow now. Thanks everyone for joining for this presentation. It's really a pleasure to share some of the work that we've been doing at Hopkins in researching new technologies to try to improve the accessibility of eye care. So I do have to start with two disclosures. The first is that I'm a co-founder, equity holder, and paid consultant of Planoptica. You'll hear about the story and the technology that the startup company is commercializing. And then the second disclosure is that I have two 2-year-olds and two 4-year-olds in the next room that my wife is bravely trying to put down for nap time. And we'll see how that goes. But you might hear some screams of agony from my side. So I'd like to start with the rationale for the importance of working in the global health area. So by whatever metric you use, in general, you tend to have diminishing returns in healthcare with investment. So the more money you invest per person per year, you tend to cover the easy problems first, and the problems get harder and harder, and your investment gets you less improvement. So the US is an outlier in this, but that's another story. Just in general, the more money we're spending, the less we're getting. But unfortunately, in industry, the market drivers for medical technologies are often looking at this area of the curve. So what technologies can they develop to people that have lots of money to improve healthcare? And often your returns are pretty incremental in this portion of the curve. So you see a lot of therapeutics and interventions that are $100,000 or more to improve lifespans, where the units of measurements are months, and this is a feasible business model. But as a biomedical engineer, my students and myself, many of us are getting into the field because we want to have big impacts with our engineering work. So I think we should really be looking at this part of the curve, where there's a large fraction of humanity. What are the big healthcare problems here? And to address these problems, which ones can we improve for hundreds of dollars rather than thousands of dollars per person per year? And so it turns out, if you look at the rankings of the burdens of disease in these areas, one of the largest problems is vision. So there's over 1 billion people worldwide right now that don't have the pair of prescription eyeglasses they need. And so this is an enormous problem. It's very consequential. It's not just a quality of life problem, though you do get a big improvement in quality of life with investment in vision care. It's more than that. There's an improvement in productivity if you have the right pair of prescription eyeglasses. There's improvements in your access to education. And these things can help you scale the economic ladder, increase your economic mobility, and then has many downstream repercussions for your overall healthcare. So I think this is a really fundamental problem that we should be investing more attention and resources in globally. And when I first started learning about this problem, I thought that maybe the main issue is that just eyeglasses are too expensive for many of these people that don't have the eyeglasses they need. I think that's not true. So in many of these settings, in low and middle income countries, you can buy a pair of prescription eyeglasses for just a few dollars. One of the big barriers, it's a very complex problem with many challenges, but one of the big barriers is that this is one of the oldest precision care medicine problems in the books. There's over 1 million combinations of numbers that you need to make eyeglasses that could fit anyone. And to determine which pair of eyeglasses out of that 1 million combinations you need takes someone with a lot of training, an optometrist, ophthalmologist. It takes sophisticated, expensive, bulky, complicated equipment to determine that prescription. And there's just not enough of these healthcare providers or equipment to suitably address the need for this problem. there are paying customers. So this photo on the top, these are people that are lined up to pay for prescription eyeglasses. And the reason there's such a long line now is because there's an eye camp that's providing that rare optometrist. So I started working on this problem inspired by other work in frugal engineering. So there's been a lot of work in the last decade at adopting low-cost consumer-grade equipment, toys, for improving the accessibility of medical devices. We've seen centrifuges using fidget spinners or spinning toys, complex laboratory analytics done with Legos and shrinky dinks. Rebecca Richards-Cordum group at Rice has been very successful in disseminating CPAP machines that are using consumer-grade components like accordion pump parts to save lives. And this is being used in many parts of Africa right now. There's a foldoscope origami microscope. It's a microscope that's made for a few dollars out of paper. And so my opportunity here was not as cute as some of these, but it's the same idea. Can we take the best way to measure your eyeglass prescriptions away from an aberrometer and make it really cheap, really durable, easy to use, and still maintain its accuracy? And the hope we had that this could be true is that at the time we were starting the project, there's a company that introduced a camera that does the same thing as a way for an aberrometer for consumers that they were selling for a few $100. So this made it think it was possible. And we spent years inventing the technology and then bringing it to reality. But importantly, that's not the only thing that you need to do. So for any of these things to have a big impact, you need to not only develop the technology, but also a suitable business model. So this was really important for us, and we started working on the business model actually before we did any prototyping. We visited our targeted patients and customers in India to understand what constraints we need to meet to solve this problem. And so we started a company, a for-profit company, Planoptica, but with the mission of social impact in mind from the beginning. And we raised funding that was compatible with this mission of trying to maximize our impact in healthcare rather than necessarily maximizing the return on investment for this company. And we partnered with like-minded organizations like Aravind Eye Care and Aura Labs. So for over 5 years, we invested the time to go from this invention to a standalone portable prototype. I'll just give you one example of a big field test we did. We tested over 700 patients in rural and urban India, a mixture in southern India. We trained a high school graduate with no experience in optometry to use our device to measure and prescribe eyeglasses using the device and compare that prescription to the pair of eyeglasses that you would get from a highly trained optometrist. And the result was for the majority of these patients that were under 40 years old, that were pre-presbyopic, they had no statistically significant difference in preferring eyeglasses from our device or from the optometrist. So this is evidence that this device can help with throughput. It can help in hospitals and school screening, not-for-profit camps like the image you saw earlier, and even in high-resource settings. So Planoptica now has sold devices that are being used in over 25 countries. In the last couple of years, we've used the device to give eyeglass prescriptions to over 1 million patients. And there's large NGOs and government organizations that have made bulk purchases with the plan to screen tens of millions of people in the next year or two. So this is just the prescription part. There's also work at Hopkins, Global Vision 2020, to make eyeglass kits where you can pop in the lenses to the right frame and assemble your eyeglasses on site. And there's work by NGOs to explore the combination of Planoptica's device with these kinds of refractive care kits to really increase eye care accessibility. Some of the research work I'm doing at Hopkins right now includes moving away from these expensive optical components like a lenslet array to something like a swimming pool where it has kind of a randomized surface. It creates these really sharp patterns at the bottom of the pool. And so you can exploit this phenomena to get the same kind of interpretable image with your camera to prescribe eyeglasses, but now we can use a piece of Scotch tape or frosted glass rather than this expensive lenslet array. And moreover, we can also image the eye with the same device. So we're working towards a device where you can not only prescribe eyeglasses, but also image the fundus to screen for retinopathies at the same time you're prescribing eyeglasses. Hopkins is a great place to do this. There's a collaborator of mine at Wilmer has started the Global Institute for Vision Equity, where they're developing a framework to encourage more models like Planoptica to come out of Hopkins and make it to commercial impact. And then we're also working beyond eye care. So I have one startup out of my course is making a reusable punch biopsy tool to reduce costs of breast cancer diagnostics in Africa. And then just to give you an idea, in closing, of the creative kinds of business models we're coming up with, Kubanda is a company I co-founded to develop a low-cost cryotherapy system. We couldn't figure out how to make this make money in low-resource settings. So instead, we found an opportunity in the veterinary space in the US. And we're hoping that selling this to vets that are using it to treat tumors in cats and dogs and horses and cows, this will cross-subsidize the work that we're doing to help develop low-cost cancer therapeutics in low-resource settings. So with that, I'd like to thank you for your time, and I'm happy to answer any questions.
Okay, fabulous. Thank you very much. So in terms of going from an idea that you have or a concept to something that you can actually get into the field, as it were, what are some of the challenges you've encountered, and how have you overcome them?
So yeah, I think it's going to be different. It's tough to give general advice on that, but for our particular challenge, one of the biggest obstacles was securing the funding we needed to scale. Just because, like I said, we had this social impact mission, we weren't necessarily focused on these lucrative markets that are going to be really appealing to the angel investors and VCs, where it's all about the bottom line. So I think for us, one challenge was the fundraising needed to get the team together that can scale this rapidly. And that kind of contributed to the length of time. I think we could have done it quite a bit faster with additional funding. On the flip side, it helps you recruit really talented and passionate employees for the company.
Right. Okay. Well, if there are no other questions, thank you again. So our next speaker